talking about the humanitarian implications of COVID-19. And, just really quickly before we get to the rest of the program, for those of you who don't know Network 2020, we are a New York-based organization that focuses on creating more informed understanding around global affairs. So we have lots of conversations like these ones on different topics related to foreign policy and international relations. So Adrienne is a senior fellow at the Harvard Humanitarian Initiative and a consultant specializing in human rights and refugee-related issues in the Middle East and Africa. Since 2007, she has worked with Physicians for Human Rights, advising its work on Sudan and Syria. She is the author of Chaos and Fire, an analysis of Sudan's June 3rd, 2019 Khartoum Massacre, and has contributed to other reports including Aleppo Abandoned, a case study on healthcare in Syria, and Nowhere to Turn, Failure to Protect, Support, and Assure Justice for Darfuri Women. She has served as the Africa Legal Advisor to the Global Justice Center, a legal NGO that works with women leaders on the enforcement of international equality guarantees. For Refugees International, she has traveled to Sudan and co-authored an analysis of its rape laws. She was a member of the Coalition for International Justice's Atrocities documentation team, traveling to refugee camps in eastern Chad to take witness statements from Darfuri refugees. For the Public International Law and Policy Group, she has worked in Cox's Bazar, Bangladesh, to document atrocities committed against the Rohingya in Myanmar's Rakhine state. She was also a clinical fellow at Harvard Law School's Human Rights Program. She has particular expertise in Syria, having lived there first as a Fulbright recipient and among former Syrian political prisoners for her graduate degree. She is the author of numerous articles, journal articles, and other assessments. And in addition to Syria, she has lived and worked in Egypt and Lebanon. She holds a JD from the University of Pennsylvania, an MA in Near Eastern Studies from New York University, and a BA in African Studies from Yale University. She is fluent in Arabic and French and conversant in Spanish. So we are very, very lucky and pleased to have Adrienne with us today to talk about the impact of COVID-19 on refugees worldwide. So with that, I will turn it over to Adrienne. Adrienne, with a quick note for everyone who's listening that there will be a point where you can ask questions. And at any time, if you do have questions, please just enter it into the Q&A box and we'll get to the Q&A portion later on. So with that, Adrienne, over to you.
Terrific. Thank you so much, Courtney. It's such a pleasure to be here today. And it's a great honor to be able to speak to this organization. As Courtney mentioned, I study the Middle East and Africa, and particularly I'm interested in refugees and displaced people and how they get access to healthcare and education during emergencies. And my research is really focused on improving those service delivery systems and helping to connect local actors to the non-governmental organizations, or as they're commonly known, NGOs, that are trying to help them. And what I love about the title of this talk is that it captures the essence of what it really means to be displaced. It means that you're without a home. And as we've seen around the world, COVID is a threat to everyone. But people's resources and their ability to avoid infection are highly dependent on factors like where they live and the manner in which they live. There are tons of socioeconomic factors that are frequently discussed in the media: race, class, age, income, type of job, legal status, and all of those impact refugees and displaced people. But on top of these factors, refugees and displaced people have many added stressors that are unique to their situation. And that's what I'd like to sort of begin discussing today. And I should say that each situation of displacement actually will vary greatly from one setting to another, and sometimes within a city. So I'll talk about that more in just a bit, but just keep in mind that when we talk about the impact of something as large as COVID on a group of people as large as refugees, inevitably we're speaking in great generalities. And so we'll try to address one specific case in a little bit. So who exactly are refugees? This is a term that gets tossed around a lot. and I think has a lot of emotional purchase. But under the law, refugees are individuals who have a well-founded fear of persecution should they return to their country of origin. And the countries where refugees currently live, we call either host communities or host countries. So that's a little bit of the jargon. The UNHCR, or the UN Refugee Agency, is the global organization. I'm sure you all know this, but just because the world of human rights and humanitarian action is so full of alphabet soup, I figure it's best to unpack it at the outset. So the UN Refugee Agency is this global organization whose job it is and whose mandate is to save lives and protect the rights of refugees, as well as forcibly displaced people and other persons of concern. And that means persons who are incredibly vulnerable to having those rights trampled upon. So we talk about both displaced people and refugees, and I think it's worth noting that the UNHCR increasingly is being tasked with taking care of internally displaced people. And those are people who've been forced by political or economic circumstances to move within their country of origin. And it's a pretty well-known fact, although it's very difficult to research in a scientific way. However, anecdotally, many practitioners note that people who become refugees are often displaced multiple times prior to being forced to finally leave their country. So it's very often the case that people attempt to stay in their country of origin and are forced to move, even if it's just down the street as an initial matter, and then to another town or village if fighting affects them, for example. So the UNHCR's job is to provide critical emergency assistance to this group of people. And that is clean water, sanitation, healthcare. It's also shelter, blankets, household goods, and sometimes food. Without getting into the architecture of the UN system, these mandates can be divided up between different agencies, but broadly speaking, the UNHCR is the person who, or is the entity rather, that's responsible for coordinating this, along with the UN coordination for humanitarian affairs. So they are essentially the organization that's being tasked with dealing with the impact of COVID on this particularly vulnerable group of people. And we know that the living conditions really impact how much you can control exposure to COVID. And once people have actually sought refuge in another country, it turns out the living situations vary dramatically. The UNHCR actually estimates that over 70% of refugees reside outside of camp settings. So traditionally, we think about refugees as living in refugee camps, which are built for emergency shelter. And the benefit of a refugee camp is that it is organized to facilitate the delivery of goods and services to these groups of people. So organizations know where individuals live, they roughly know when to find them, and they're geospatially located in a way that allows the delivery of goods from point A to point B, or a food delivery system, for example. It becomes a lot more complicated when people are living in cities, towns, villages, border towns, shanties. And so the job of the UNHCR, increasingly over the past few decades, and certainly within the past decade, has become very challenging because it's hard to locate refugees and displaced people who may be just living in a poor suburb. And so getting them the goods and services that they need, or even may want or may not know about, becomes increasingly difficult. So at the same time, I always like to say the people who are the experts on refugees are refugees themselves. And so unless and until NGO workers can meaningfully interact with refugees and listen to them and understand what their local experience is, it's very hard to create a good delivery system for services and goods. And most of the time, it's going to be quite unique. The rule is, it's hard to have a rule because there's so much variability in terms of weather, geography, the political and economic conditions in the host country. And so connection with the people that the humanitarian community are trying to serve is paramount. And connection is what is so difficult during COVID-19. So I think no one will be surprised to hear that COVID is having a really significant impact by worsening the socioeconomic vulnerabilities in both refugee and host communities. The UN estimates that there are almost 26 million refugees worldwide. So that's a big number. And today I'd like to focus on the example of Syrians living in Jordan. Keeping in mind that Jordan hosts large numbers of refugees from all over the world and has done so for a long, long time, since the Second World War, certainly. And Syrians are kind of a special case in Jordan because they are so numerous for lots of important reasons that go beyond today's talk. But Jordan just simply happened to be a very common place of refuge. And they are relatively recent arrivals. So 2012, 2013, there were massive waves. Hundreds of Syrians at a certain point were crossing the border on foot every day. And for that reason, they illustrate the problems of refugees because they live in both camps and urban settings. Most of them are actually in urban settings. But there are these really important camps that many will have heard of, Zaatari and Azraq. And these are camps that the UN and government partners, donors, created under great duress. And they've been well studied, in part because they are pretty well organized. And I happen to know, just anecdotally from people who were involved in pulling them together, they came together very quickly in a matter of days. So there's a happy story there too, in the sense that when there's political will and when resources are directed, much can be done. Having said that, I don't think anyone would elect to live in a refugee camp, although during a pandemic, it might make you more likely to receive certain kinds of goods and services. So returning to the sort of larger case of Jordan, Jordan has been on a strict lockdown since March 21st. So they declared an emergency, I believe, on March 14th, and then quickly afterwards enforced a very strict lockdown. Curfews, people can only travel by foot, and in many ways this has helped keep COVID transmission down, but it's also been an interesting case study of the adverse impacts on populations that are vulnerable. And that includes not only refugees, but vulnerable, poor, strata of Jordanian society as well. However, it must be said that refugees are really poorly resourced because they often lack social networks for reasons that are obvious. A recent study by the Danish Refugee Council of 867 Syrian refugee households in Jordan found that only 3% have a family member who's employed, and that's as of a week ago. Now, this is down from 65% before the crisis. So it's a significant decrease, and the majority of households, nearly 80%, reported that they do not have enough food for the coming 2 weeks. So in terms of the UN mandate, this poses a significant crisis because their job is stabilizing, conditions of life for these populations, and yet they're under, particularly in the urban settings, they're really under a lot of pressure. People have lost their livelihoods and their sources of income, and they just can't meet their basic needs. And they may not have social safety nets or the social protection systems that would normally help them through. And I think that's a story that's familiar to us from the United States, certainly. And I think it's fair to say that COVID, in many ways, it's less that it has created problems, and it's more that it's shown the cracks in the systems that we have, in terms of there just being so little safety net. I mean, quite frankly, in Jordan, I'm not, you know, for a country that is worked hard on certain kinds of social protections, this is a huge challenge, because they're hosting large numbers of non-citizens, in addition to citizens who they are bound to provide services to. So the problems are not small. So if we ask, how are these COVID restrictions actually impacting Syrian refugees in Jordan? Well, the UN reports that the refugees are eating less food. That's how they are dealing. They are simply consuming a lot less. And the sort of shadow side of the adherence to the social distancing and the other containment measures is rather that there are increased chances for sexual and gender-based violence against women and girls, child abuse, and any other negative social coping mechanisms that may be happening within a household that has come under increasing pressure. That's also a familiar theme from the non-refugee world, but it's greatly intensified when there's so little contact with social service providers, in part because if you're an urban refugee, you may be a hidden population. And so persons who are vulnerable are even more so. So unemployment, underemployment, and poverty are rising. And we know that everywhere. They're rising in host communities. And refugees are basically working in the informal economy in Jordan. Although there have been very interesting attempts to engage them in the formal labor economy, the majority prefer informal labor for lots of reasons, including flexibility and the fact that it's much easier to get a job in the informal economy. But that has dried up because they're working primarily in restaurants and construction. And they're not covered by Social Security or other safety nets. And so it's really hard for them to meet their needs. Unsurprisingly, social tensions between the host country members and refugees are rising. And that, the sort of secondary effects of that tension are unknown, but they don't look positive. So in addition to that, you have the access to education being really impacted. Learning has been disrupted for millions of youth, and schools and educational institutions have been closed. And it should be said that the majority of students who are learning in Jordan from Syrian refugee families are doing so on smartphones. And the majority of families who are, I mean, it's very common that there would be one smartphone in an entire family. And spatially, there's very little room to find a quiet place to study. And even more important than the physical hardware of a smartphone, internet access is both costly and quite difficult to secure. And so the learning schema, which the Jordanian government has made all of its educational opportunities available freely, unfortunately, the barrier to entry is access that is to the internet that's stable. And so I think about 50% of students are reporting that they're using the Jordanian, in a recent survey, they're actually using and accessing the Jordanian education portal, but something like 65% of them are reporting technical troubles with it. And I think any of us who are navigating online education for children or younger relatives knows that that's just reality. And it's even more so if you're living in a tent in northern Jordan, with very poor internet access to begin with. So that is certainly going to intensify problems. Another important aspect is that non-formal or vocational education, which can be a really important lifeline to accessing livelihoods for this population, has been severely impacted, simply because mobility has been impacted. And without these vocational opportunities that are critical to earning a livelihood, the prognosis is not good for these populations. So humanitarians now have to reach millions of people every month across the region using remote modalities. So certainly the challenges are not small, and they were never easy. It should be said that humanitarians are providing services under duress, right, in some of the most difficult situations. And now that they can no longer work face-to-face, they're going to have to be very creative. And there may be a silver lining in the sense that local partners may be trained and empowered to carry out some of the work to the extent possible. I mean, it really depends on what the service that's being delivered is. We're lucky to live in an age where telecommunications are robust. At the same time, this is not going to be easy for anyone. And part of this challenge is to deliver inclusive and gender responsive programming. And so it's not just getting a sack of lentils to a family, it's doing so in a way that reaches all families, including those who maybe where households are headed by individuals who are disabled, or maybe headed by, for whatever reason, like a minor female. And so taking into account all of the barriers that those individuals may have is not going to be an easy task. And yet, fortunately, there are smart people working hard on these issues, including some of my colleagues at the Harvard Humanitarian Initiative. So, you know, I'm very thankful for their work. And I think that that is this is a great opportunity to really push on inclusivity and gender responsive programming, because if we're going to have to remake it, we might as well do it as well as we can. So to help host countries curb the spread of COVID-19, humanitarians are going to have to find a way to provide a range of health and non-health interventions with a focus on what we like to call protection, or keeping people physically safe, which is really an extension of the guarantees of the Refugee Convention. And a big part of that is providing cash assistance to reduce socioeconomic hardship. And if we're finding it difficult in this country, we know that it may be very challenging elsewhere. Fortunately, there are organizations that are working hard on direct cash assistance, and we can learn from these models. So I think it's important to also talk about the human-to-human interaction between humanitarians and the people that they're hoping to serve. And one dynamic of the interaction is, well, humanitarians always talk about access. So what is humanitarian access? It's the ability to get into the places where goods and services can be distributed and getting access to the people in need. So being able to deliver the goods and services in a meaningful way because you can physically get there and you can connect with individuals. And usually humanitarian access, we talk all the time. I mean, vast tomes of literature and important academic work is done on this issue. There are practitioners' networks. There's a robust discussion about how to get access. Usually it's about fighting or damaged infrastructure or a natural disaster. But in a pandemic, the problem is fear and mistrust. So trust becomes paramount. And trust is really difficult even in the best of times, but during a pandemic, there's a lot of fear of people who are coming from outside. And anecdotally, we know that individuals can really reject unknown actors. I mean, we saw this in the Ebola crisis. I have a colleague who has done a lot of survey work based on mistrust and attack of healthcare workers actually in the Democratic Republic of Congo this summer because of the perception that it was the healthcare workers who were spreading Ebola. And I think that we're beginning to see that in a variety of settings, unfortunately. And humanitarians, healthcare workers in general are exposed to a lot of physical danger, not only from the illnesses that they treat, but because there's a lot of hostility directed at them. And that may seem counterintuitive, but I think when helping very vulnerable populations who may or may not be familiar with the way in which healthcare is delivered in the humanitarian's home country, there can be important problems in communication, and sometimes it doesn't go well. Also, emotions run high when people are sick. So in northwestern Syria, we know that airstrikes are ongoing. A sort of confrontation between Russia and Turkey is ongoing. There is a war running in the background, and humanitarians who are trying to help implement COVID protocols are being accused of bringing COVID into populations in Idlib and the surrounding villages, where 43 children are being killed in a market strike, for example. So there's already a lot of strong feeling about loss and grief. And let's just say that people showing up wearing little humanitarian vests and telling people to wash their hands and stand 6 feet apart from each other are not necessarily, the message isn't being greeted with with recognition of the intent with which it's being sent. And so there's a great opportunity to try and figure out how to deliver culturally responsive programming that's going to reach the target population. And that's, human interactions are always the toughest, but they are the most important when it comes to successful programming. So in conclusion, we're all facing the same threat, and we each have different resources with which to combat this threat. In a pandemic, health officials tell us that what's really needed to beat a virus like this is trust and communication. So trusting that the information you're getting is good and that you can rely upon it, and trusting that if you tell a health official about your status or your symptoms, that you will not have an adverse consequence. And that's a big ask for a population that's lived through displacement and loss and may or may not have a very secure sense of residence in a place, and may not trust officials, quite frankly. So trust and communication, these are our two critical intangibles, and they are in short supply even at the best of times. But in a humanitarian emergency, there's even less trust and willingness to communicate. And in a pandemic, it's really, we're experiencing aspects of a humanitarian emergency in our own domestic context. And so perhaps it will give us a chance to imagine how to create some better programming and building trust within affected populations so that we can have more successful program delivery. Thank you very much.
All right, Adrienne, thank you very much. And it sounds right now as though the crisis is less that one would imagine in terms of COVID-19 tearing through refugee camps, and more that of the economic peril that a lot of displaced people are facing. As before, oh sorry.
Well,
before we turn to the Q&A box.
Oh yeah. in response to
go,
what
go.
you said, Courtney, I think it's
Yeah.
really important because the truth is we don't know. Surveillance is very, very limited. And so COVID-19 may or may not be ripping through these camps. Certainly, we don't hear reports of it, but that doesn't mean, I think there are so many things that are unknown about this disease that it's very hard to know why and how the health outcomes will present in these refugee settings. I think for refugees themselves, what they're worried about is not COVID, it's not being able to eat.
Yes, yeah, that's the more pressing concern at the moment. Okay, that's very good to know. Before we turn to the Q&A box, I'd love to just kick it off with a question or two of my own and give people time to put some questions in there. So, you mentioned earlier that the crisis has, shown light in the cracks of some systems, and that's a common theme that I've heard in a lot of other talks, is that the COVID-19 and coronavirus has really shown where the cracks are. And another common theme that I've heard is that it's accelerating trends. And so I'd be curious if you could comment on whether or not you've seen in terms of the humanitarian response to displaced people worldwide, is this accelerating any trends, whether among the displaced populations themselves or in terms of the response to their predicament?
Really good question. I think it's hard to know, and here's why. Humanitarians, by definition, are doing almost like an emergency room situation job, except if service provision were emergent, right? Like, their concern is getting people blankets and food and water and medicine. And so keeping track of, when you look at the data, it's being produced, but it's often produced, just because of the reality of the job. The person who spent 10 hours in a camp and has traveled, 1.5 hours there and 1.5 hours back, and, spent 10 hours surrounded by dust trying to locate the beneficiaries, the reporting can be hit or miss. It's in a number of different languages. This is one of the reasons that organizations like the Harvard Humanitarian Initiative exist, because it provides a place for individuals with knowledge of what happens in the field to do the sort of bigger number crunching, and it assists with things like monitoring and evaluation. So I would say that I have not been looking for accelerated trends. I'm sure that some of them have been accelerated. I'm also sure that there are things that were ongoing that are no longer happening, right? Anything that's in person, learning projects. I think it's a really important question and one to keep in mind, but I'm not sure that I have any observable humanitarian insights to give. I will say I was looking at data that's made available by the UN, and they were listing, within all of the different sectors, within different settlements, how many girls, how many boys, meaning individuals, female and male under the age of 18, how many men, how many women, how many tents, how many, medical, how much medical infrastructure. And, it's just a very big spreadsheet. And some of these communities are very small, some of them are big. It's hard. I think maybe if you pull out, you can see that the trend, look, the focus is now on containing the pandemic. And I think there's, if nothing else, COVID-19 has shown the world that we are all connected, and that what happens in one place will inevitably impact all of us. On the other hand, we don't understand it well, and it's a complex phenomenon. So I don't know if that's responsive to your question, but I think maybe yeah.
It is in part because I don't know the lay of the land. I think what I had in mind, and this is when people who are outside started to jump to their own conclusions. But I thought it was very interesting when you mentioned cash payments, and I was wondering if if there had been experimentation with trends like blockchain or mobile disbursement of funds, and is that just way too advanced when you're just trying to meet really basic needs?
No, it's a great question. I think certainly there's a lot of very dynamic research being done on cash-based, being cash disbursements, and they've used cash cards. I think being able to access a bank, it's a really rich topic. And I know that a number of different modalities are being employed. I think banking systems are pretty conservative with a small c, meaning that the individuals that I know who are involved in this kind of development enterprise say that someone still has to go to the bank to send an enormous amount of money from London to whereversville. There's a certain amount of human to human, I think, because moving large amounts of money is complicated from one institution to another, and there's a lot of compliance involved, and donors like to know how things are being dispersed and in what manner. And I think all of that is kind of the break on the movement of funds. And then you have technologies that if a person has a smartphone, which many people do, they have access to a lot of really powerful technologies. And so the question is how to bridge the gap between the potential and the regulations. And both are very important. Regulations exist for a reason. And certainly we don't want to create a permissive environment, but I think recognizing that cash-based assistance helps people make better decisions, honestly, with the resources that are given to them. And I think there's a vast literature on that. And yeah, I think blockchain is being used. I think blockchain, though, is it's still in its infancy.
Yeah, and that's a term that I admit I throw around without really understanding it all. But thank you. I think that's a really important point that you made about the gap between sort of the potential and the regulations. So thank you. And so with that, I will turn over to the Q&A box. So our first question is that the person is writing that I've read that refugees around the world are afraid to seek treatment for coronavirus because they fear they'll be deported if their documentation isn't in order when they get to medical facilities. Are we seeing these deportations happening, and what can be done to protect refugees when they seek medical help?
That's a great question. Everywhere, actually. I think we're seeing a variety of responses from the host communities and the host states. So, for example, in a place like Turkey, you have 81 sort of principalities or little states within this very powerful federal system. And so there are some decisions that are going to be made on the state level. You have the same thing in Germany, right? I think immigration law is set at the federal level, and then it's going to be implemented in ways that can be contested in a court at the lower level. So that's sort of the first big idea, right? I think the answer to your question is yes, people are afraid because they do not want to be deported. And that was true, honestly, prior to COVID-19, and it's just intensified. I think, I don't have any great examples of countries that are really doing it right, mostly because there's just such a a fire hose of information about COVID and refugees and immigrants that it's hard to parse out. Most of what we're hearing is the ways in which the pandemic is being used to control and exclude people and close down borders. Certainly that's the case in the United States. The goal of our current administration has always been to shut the southern border. And that has now been done very cleverly using a little known part of US law that enables, under this public health notion to shut our borders. I think the tragedy is that shutting borders doesn't actually stop transmission of a pandemic, because human beings will still be afraid, right? If they've actually, if they're here without legal status, they're less likely to declare. And I think because people who don't have a settled legal status are afraid and they tend to be economically vulnerable, they're going to be more likely to continue working even if they feel sick. And that's just reality. So I think they are afraid. They may also not believe what they're being told. And I think we've all had the experience of information changing very quickly. We get these sort of waves of new symptoms and, now children with COVID toe, so I think even people who are regular consumers of, scientific literature are finding this a little bizarre. It's a novel virus. And so I think for a person who doesn't follow medical conditions closely, it could probably feel surreal, and that would be another barrier to accessing healthcare, particularly if they just don't see any benefit in it.
Mm-hmm. Yes. All right, thank you. And our next question actually follows a little bit on something that you touched on, and that is obviously COVID-19 has made it more difficult for refugees to find shelter in other countries because borders are closed. But what do you think will happen in the coming months and years as we reopen? Will states go back to their normal policies on accepting refugees, or will the virus be used as an excuse to keep refugees out? And what measures can be taken to ensure the future rights of refugees?
Wow, that's the $6 million question. I think in terms of refugee rights and the global conversation on refugees, this conversation has been going on for a long time, right? We have this new global compact on refugees, which is designed to be a framework. It was adopted in 2018 by the United Nations. It's supposed to create a framework for countries to enter into willingly and share the burden of displaced people and refugees. And that emerged from years of conversation. And so this is like a slow moving glacier. And I think if we think of the sort of the impact of a mass displacement of humans from mostly political disasters, but also climate, ecological, natural disasters, the legal frameworks we have are never contemplated the size of these displacements and the frequency with which they happen. Right? So the law is very slow moving. And in many ways, we want it to move slowly because we want it to be quite considered. And once a law is adopted, it can be really hard to strike it down. So you want it to be a good one, right? And I think that the International Refugee Convention that we have, which is the 51 Convention, really considered World War I and II and the kinds of displacement. there were echoes of the things that we're seeing now, but we're just seeing so much more frequent and so much more geographically diverse than previous. And so the question is how to work within that legal framework. And so I think, I'm an attorney by training, and I think that that's probably the right way to go, is to work within a legal framework. And unfortunately, I think, I have colleagues who are very smart, who believe that a new convention on migrants or a new legal tool would address this set of issues. And unfortunately, I'm just not very sanguine. I think that if we tried to produce a new convention, it might be a lot worse. And maybe that's just the pessimist in me speaking, but I think the way forward is to look at the tools we already have, because we have a lot of them. We have the human rights body of law, we have the Refugee Convention, and then we have a lot of, international law can be, it's created over time and practice. And so I think a lot of it is about consensus building and working closely with other states. Now, something that we have not seen a lot of in terms of US diplomacy is working closely with other states. And so it's not clear to me that the United States is going to be at the forefront of, of leading the future conversation on refugees. I would hope that it would be, because of the history of our country, but I'm not sure. Because it will require coordination, and it will require a spirit of collaboration that I'm not sure prevails right now. So to get to the earlier part of the question, which is, we've seen that these borders are shut down. Do I think it's going to be used to exclude refugees? Sure. Because we have a wave of populism in the world, and it is appealing to think that if we shut our borders, we will be safer. It's not clear to me from a scientific perspective that a pandemic will be affected by that, because people who are not refugees have COVID-19. And, we in our country have done very selective bans on travel that have not been terribly effective, right? So I think that physical closure on a country-to-country level is probably going to be used as one of the tools. I think in our global economy, it's not really a sustainable practice. So the question is going to be how we imagine a future in which we try to protect ourselves and others from a really deadly virus before we can get a vaccine. And I think it's very important to be safe. And I am a firm believer in strong public health measures, but I think the way forward is not to make people afraid. It's to build trust so that people will feel like they can report their symptoms and be supported in whatever quarantine measures they need, because that's what's going to keep communities safe.
Mm-hmm. All right, thank you very much. The next question, and so we're starting to here. We got a few more questions coming in. So thanks for your talk. I am curious if you can touch on how the implications of COVID are affecting refugee and host community relations in the sense of interfacing at marketplaces and within agricultural settings where close physical proximity and social cultural exchange can occur. Your emphasis on food security being more important than ever right now might require more collaboration and resilience amongst refugees and host communities. Is that happening, and is there reporting happening on this relationship?
It's a great question. So I don't know of marketplace procedures. I know that curfews are in place. I know that there have been vast misfires, for example, in the Jordan situation. I believe on March 24th, so 3 days after the lockdown in Jordan, there was a giant, there was a giant brouhaha where at a bakery, there were a bunch of people who got in a big fight. You know, I think that, and we saw also in Turkey, you know, that there was a set of curfews that were announced 2 hours before the curfew was to go into place, and people ran out and stormed markets. So I think there's lots of opportunity to improve on the pacing of shopping and social distancing while shopping. I think social distancing is a tough sell when people are more worried about staying alive and getting enough nutrients. It's, you know, it's analogous to telling people about data security when they are trying to send images of injured people from a war zone. And it's important, and yet it feels very remote from their immediate concerns. And therein lies the rub, right? Like if there's going to be a public health program that works, it needs to make sense to the people who are participating. And so I think the questioner is getting at, okay, how do the host community and the refugee community negotiate those interactions? And I think, you know, what I've seen in some parts of Jordan, particularly in the north, is that there's already a lot of segregation between these communities going on because there's already so much animosity. So Jordan is a very water poor country. And it is, you know, and Syrians drink from the tap. So they're very used to, Syria is a water-rich country. And so the usage of water among Syrian refugees has been very, you know, the optics are terrible because they are free users of water, or were at least in the beginning, and this made a terrible impression on the host community. And I think, you know, communities in northern Jordan are often very poor. You know, not some of Jordan is quite well developed, and you know, obviously they have tremendous human capital. There's been a lot of investment, but there are still a lot of places where, you know, there's just not a lot there. And when you move 1 million Syrians into the neighborhood and they're using a lot of water, they've already made a bad impression. And so the tensions between that particular host community and the refugee community are a pre-existing problem. And you see it even, you know, years ago in 2014, we saw there was a school building that had been used for a meeting of community leaders within the refugee community. And the local host community was incredibly angry that the school had been used by that community, and they burned it down. So the feelings are strong, and it's not an easy conversation to navigate. And I think the answer is to make the pie bigger. And I think this is not a new idea in humanitarian interventions, but it takes a while for it to sink in the sense that often large refugee sort of habitations or settlements, camps, are built up in some of the poorest places that are least populated, because there's a lot of land and you can build a camp for 750,000 people without disrupting infrastructure. And often the host community is not well resourced. And so a good practice is always, when creating a program, to provide services for the host community as well as the refugee community. And I think that's that's become a commonplace of humanitarian practice, but it was not always the case. And I think it can be very challenging in the face of a terrible emergency. And it should be said that the UN Refugee Agency's mandate is not development, right? And this is getting at like sort of underlying tension between emergency interventions and development. And I think that after the World's Humanitarian Summit in 2016, and after, you know, I think that we're increasingly coming to a moment where people realize that humanitarian interventions inevitably link to development, but it's still not an easy conversation to have, because analytically and legally, they're really two separate mandates.
All right, thank you. So I think we probably have time maybe for just one more, but let's see how we get through this. So the next question is how unique, where to go? How unique is the situation for refugees of the Rukban camp in Syria as compared to other established camps within the country? And other than returning to Assad-controlled areas, can the people be transferred to better humanitarian aid supplied camps?
Mm. Well, I think that's a great question that, to which I think part of the question, how unique is it? It's quite unique, because if I'm understanding correctly, Rukban is in a sort of berm area in between southern Syria and Jordan, and there is no infrastructure. And individuals have been trapped there, and it's been a humanitarian crisis ongoing for a long, I mean, periodically individuals are able to leave, but they're really caught in between a closed border and force on force fighting. So it's a really bad situation, and it is not a normal humanitarian situation, because sort of under kind of classic humanitarian practice, one would never build, for example, a camp or any kind of structured, contemplated, planned out habitation close to fighting. In fact, you're supposed to be a certain number of miles from the border to avoid that. But that's not reality. Reality is that individuals get trapped and they can't move. And so if I'm correct in understanding the questioner's question, the answer is, it is a unique and terrible situation. And it was unique and terrible before COVID, and it's even worse now because they have even fewer resources. So again, going back to the formula of everyone is dealing with the same challenge, but each of us has resources that are unique to our situation. And for those who are stuck on that berm in between Jordan and southern Syria, their resources are incredibly few. So there was a second part to the question. Can you just read the second part? How unique?
Yes, yeah. It's about whether or not there's a possibility to, other than returning to Assad-controlled areas, can the people be transferred to better humanitarian aid supplied camps?
Well, the answer is always, if there's political will. Of course they can be transferred. Sure. I mean, I think the question is, who would benefit? And I think that for those individuals, returning to Assad-controlled territory is not appealing. And yet, the Jordanian government would need to, the Jordanian government or some other government would need to accept those individuals. And that's where it becomes challenging. And, you know, it's not an enormous, I forget the actual census, but it's not a large number. We're not talking about 750,000 people. We're talking about a relatively smaller number. Certainly they could be moved. The question is, with whose army, literally, because they would need to be a host country would need to take responsibility. And I think the case of Jordan is really tricky, because the Jordanians have long been concerned that what happens in Syria will impact them, right? They're just very closely linked. And Jordan never closed its Syrian embassy. The Syrian embassy in Jordan has remained open. Diplomatic relations remain, despite the fact that by some counts, 1 in every 5 people in Jordan is a Syrian national. So despite this huge refugee population, Jordan still has important diplomatic ties with Syria. And so the question is, what would make it appealing for Jordan to take this group of people? or another country, quite frankly. I think the problem is that right now countries are already feeling overextended. And that's tough, you know. I mean, it's a dire situation. It's been a dire situation for a long time. And the question is how to make it an appealing diplomatic narrative that would allow some country to be really heroic. You know, you see in the Syrian context, countries taking advantage of opportunities to be sort of diplomatically savvy. For example, in Libya, they granted the Syrian opposition the use of their baccalaureate so that Syrian students who were living in opposition-held territory could take the Libyan baccalaureate exam and have it be accredited and recognized by Tripoli. So, you know, it's certainly there are interesting opportunities for activism, but it's not clear to me which country would step up in that case.
All right. Okay. Thank you, Adrienne. It looks like we're past time, and I apologize to everyone who wanted to ask a question but couldn't. And Adrienne, thank you so much for joining us today, and for your work too. I think it's very important work, and you know, judging by the talk, it is extremely complex, and you probably need to draw on many areas, not just your law degree, but it sounds like a lot of psychology and communication as well, and quite, you know, in quite difficult circumstances. So thank you. To everyone listening, we're doing a briefing actually on Yemen on Monday, this coming Monday at 12 p.m. Eastern time, and then followed by a discussion on North Korea on Thursday, May 14th at 6 p.m. Eastern time. So just for those of you who are listening, and Adrienne did reference the ongoing conflict between Turkey and Russia in the Middle East, and in Syria in particular. And for those of you who didn't participate in our webinar a couple of weeks ago, we had Eugene Rumer and Stephen Cook talking about just that, and that is actually on YouTube. So if you'd like to go take a look, please do. Adrienne, thank you so much, and thanks to all who participated today. Have a great afternoon.
Bye.
Bye-bye.